Okay, so first of all, this is the total gut restoration. I gave you links on the email. The first links on this presentation is for the total gut booklet. That's going to be the protocol. And I also have a link for my YouTube videos. If you get cut off, if you have trouble hearing or seeing, know that all of this information is recorded in somewhere in these links. So the personal story, and that's generally how we start our presentations. And know that I've put that, I'm not going to spend a whole lot of time on it, but I want you to know I've had a lot of education. I was, in a master's program at the University of Glasgow, worked in Stockholm in microbiology, went to school in Moscow for a bachelor's of bacteriology. I'm a certified clinical nutritionist. I practice as a traditional naturopath. I married a brilliant traditional naturopath. So we've got a lot of background and we want to help you utilize our experience. Let us help you. So go ahead and click on that video. Hopefully it will encourage you to call, and as well as all of these others. So the plan today is I'm going to do an introductory total gut restoration because many of you have not seen this. And then I'm going to go into another presentation in the weeds and really get into some of the advanced information. So the first slide here, this is what I said in the constant contact. I want to start off with trying to change your mind, to get this paradigm shift, to get you away from the idea, the model of, oh, you just received a test report back, this person has Escherichia coli, now start blasting it with, the A-bomb, the killing protocols, the Roundup, and eradicate it. That's the pharmaceutical approach. That's the big ag approach. And as functional medicine practitioners, we have learned a better and new way. Just because you have a sledgehammer doesn't mean you have to use it if a toothpick will do the job. And if I can get you to start thinking about this complicated, vast ecosystem that we know less about than the surface of the moon, as an organism in itself that has a personality, that has a community, that, remember what we've been learning these last few years, that there are 10 trillion human cells, but there are 100 trillion bacteria cells. There are more of them than there are of us. And as far as genetics, if we have 23,000 genes in our DNA, they have 100 times that many, and we depend on their genes to perform the biochemical reactions that make us human. So this is, you have to expand your mind to really get it around what this means. And we're going to go through some real exciting information that shows you the neurotransmitters, the hormones that the bacteria are making for us, that change, that make us human. And that they are the ones that metabolize our vitamins and our minerals and our amino acids. So by knowing what bacterial populations you have will tell you a lot about the biochemistry of what is going on with yourself, with your patients, with your community that you're educating. So again, if you're going in there with an antibiotic or with Roundup, what you're doing is just you're killing everything that it touches, and you may not even affect that supposed pathogen. And that supposed pathogen may be not causing any problems. And first of all, know that the identification limitations of the laboratories that you're using are just giving you down to the family. So what if it says Escherichia coli? There are certain strains of Escherichia coli that are completely okay, commensal. They're supposed to be there. There's other strains that are hemorrhagic. They're deadly. They're not good. But you're not getting the information of which is which. And they're assuming this is the pathogen, and you're going in with these very disruptive killing agents. And just like Roundup, you're killing everything in sight, causing a bunch of resistant organisms, and there's more damage than there is good. So that's what I wanted to start off with. I'm hoping that through these lectures, I can impress upon you a better and gentler way. All right, so let's get going. This is a great slide that is good for education. I encourage everyone to print it off, laminate it, put it in your exam rooms, and educate your patients, guests, clients about the gut. So the gut integrity is very important. There's three major areas that we focus on. The first is here, the mucin 1 layer. This is what Megaspore works on for reconditioning. The second is exemplified by this symbol here, and it's really to emphasize the importance of keystone strains. We know that there are certain keystone strains that are part of your unique fingerprint microbiome that protects you from chronic illness. And that's where the Mega Prebiotic really focuses. The studies, we've looked for specific oligosaccharides that promote specific keystone strains, and that's what that step is all about. The third step is the rebuilding of the mucin 2 layer. And you can see the mucin 2 layer protects all the underlying epithelial cells, the tight junctions, the microvilli, keeps everything intact. This other side is showing you leaky gut, i.e. metabolic endotoxemia, when the gram-negative bacteria release their outer coat, the lipopolysaccharide, the most potent endotoxin, starts eating into that mucin layer, degrades it away, and then you've got no tight junctions, you've got damaged epithelial cells, you've got massive lipopolysaccharide endotoxin leaking into the lumen, you've got pathogens leaking into the lumen, you've got undigested food particles leaking into the lumen. This here is the site of the genesis of autoimmune disease, food sensitivities, systemic inflammation, chronic illness, right here. So if we can have a system that stops this, we can effectively stop and affect every chronic illness, right? So that's why we focus on metabolic endotoxemia. That's why our groundbreaking study was on metabolic endotoxemia, lipopolysaccharide, because that is really what starts the whole degenerative process. Okay, so let's highlight. We need to have mucin 1 to have an increased microbial diversity. We need to work on lowering the levels of pathogens and toxins. We need to increase the thick mucosal barrier. We need to strengthen the epithelial tight junctions, and we need to reduce the inflammation. So that's what our program is designed to do. These are the reasons typically that you're going to have a damaged gut, a leaky gut. You're going to have increased metabolic endotoxemia because of antibiotics, killing protocols, excessive alcohol, smoking, stress, lack of sleep, intensive exercise, artificial sweeteners, saturated fats, glyphosate. So this is the program. The protocol that you have the link to will show you a titration. We always start, this is the foundation for all of the conditions. We always start with Megaspore. It will tell you a lot by the reaction that your patient, client, guest has, because it will, again, you're pushing against this organism. Even when the organism is sick, there's going to be pushback. And that's what you're looking for. If there is an intolerance to megaspore, then you know you've got a lot of damaged epithelial cells and a lot of dysbiosis. A lot of our practitioners call megaspore the poor man's diagnostic test. So this is the manual way. This is going to be the most cost-effective way, is to really learn what these pushback, die-off, reactions, symptoms mean. So you start with a half to 1 capsule every other day for a week, then 1 capsule a day for a week, and you work up to that 2 capsules a day. You always give it the largest meal. You take these with meals, and we have whole lectures on the hows and whys of probiotics and the false information you've probably been receiving the last 25 years. The second step is the prebiotic. You add to the megaspore after that first month. You start with a half a scoop for the first week, and then a full scoop for the rest of the month. And then the third month, a half a scoop the first week, full scoop for the rest of the month. And you're on all 3 products at this point. At the end of the 3 months, your powders run out, and you maintain with megaspore 2 to 3 times a week. That's the foundational protocol. What products you add on top of that completely depends on how the individual is tolerating the products and what other conditions rear their head, like H. pylori or Candida or GERD or upper digestive problems, other pathogens. But this is where you start. So some highlights on what megaspore is doing. Again, it's the primary reconditioner. It's going in to force out the weeds. So we're talking about changing the terrain, and it's easy to use the soil because our gut is very much like an agricultural model, that you condition the soil, you grow better crops. You fertilize the soil, you grow better crops. We've identified some real important keystone strains: Akkermansia, Mucophylla, Faecalibacterium prunetii, and Bifidobacteria. These are really the superheroes that keep people healthy. And to understand how smart the bacillus spores are, for example, if you are not familiar with quorum sensing, there's some great TED Talks on quorum sensing. And megaspore has a hierarchical quorum sensing ability. Quorum sensing is a chemical surveillance system. They know when they're being digested, when to come out of the spore stage and start to colonize. Because of this chemical sensing system, they know when they come out of the spore stage, who's in their environment, how many, and what species. If there's a pathogen there, they come out of the spore stage having manufactured a customized antibiotic specific for that pathogen, like a smart bomb, and comes out and blasts it. So we can't just blanket say we need a killing agent and wipe out everything in the environment when these organisms can so specifically go in like a sniper and get these guys without hurting anything. So use these spores as your frontline defense. Let them go in there and act like the police force and help that environment first and foremost. Okay. And here's all the things that megaspore does. Okay, so in my other lectures we go through the myths of probiotics. It's the whole thing about refrigeration. These are very stable. You don't have to refrigerate. They survive the gastric barriers. You don't have to rotate probiotics. These in themselves increase diversity by 45%. They increase the short chain fatty acids. They produce the full spectrum B vitamins, vitamin K, antioxidants, and like I'd mentioned, specific antibiotics. So, this is where you start. And then the second step here on the prebiotic, let me move that all the way out, is really to help those keystone strains thrive. And we have, in the next lecture, we'll go through the actual studies that we've done on these products to show that they help these keystone strains thrive. And that it is really an important step in this whole process. And they do that because they've got specific oligosaccharides that feed them. Okay, and those oligosaccharides, the XOS from non-GMO corn, the FOS from green kiwi skins and gold, and the GOS from cow's milk. Yes, the FDA requires that we say it contains these food products. It does not contain these food products. These are very specific isolates of oligosaccharides. So there are no immunogenicity. There's no immunoreaction from these food products because they're not in an antigen form. They are non-immunoreactive oligosaccharides. So you will get that question. Sometimes people will just see that on the label and they will break out in hives. There's nothing you can do about that. Other people, you explain it to them, they use the product and they are fine, even if they are sensitive to those products. The third step is the megamucosa. Again, it is going to rebuild that mucin 2 layer. It does that with some key ingredients. The immunoglobulins, this is IgG 2000, the original formula derived from bovine serum, and it's stronger than any colostrum or any other egg immunoglobulin product by 50%. So it has none of the egg or dairy reactions. Very powerful. We use this product, we'll see in the next slide, for a number of things. The amino acids that are here increase the mucin production by 95%. So this is a very key ingredient. And then the citrus polyphenols shut down the oxidative stress of that, chronic systemic inflammation that's going on. And then we do have IgG 2000 as a standalone product because it's so important to neutralize that lipopolysaccharide. And for your individuals that are extremely toxic, this is just a really helpful product to have on hand. Sometimes you might even pre-treat the gut because you already know these people are sensitive to everything you put them on. So you can start very slow. You can even start with one spore probiotic and graduate them to the 2-spore probiotic and then graduate them to the 5-spore probiotic, because their immune system is so damaged, they have lost the ability of their T regulation of recognition. And the spores help the recognition. They help revive those T cells. So that's an important step, to just go slow and give their immune system a chance to heal. Okay, so you can see here the specifics on the IgG 2000. There's a lot of studies. This product saved the livestock industry in the United States. It's very powerful. There's tons of studies. You'll see that Megaspore and this product, they all have studies with HIV, just because that is kind of the worst of all gut conditions. It's extreme metabolic endotoxemia. And if you can show, the improvement that we have on that in that condition, then it's totally safe. Now, I put this slide in here just so that you have a firm understanding that a lot of companies, they present a lot of studies, but they are cohort studies. They are not studies on the actual product. They are individual ingredient studies that they put together and assume that's going to work in their product. And that's fine. We use cohort studies to establish our program, to show that, spores recondition, or that oligosaccharides feed keystone strains, or that amino acids improve mucin. And that's great. That's how you can establish protocols. But there aren't many companies out there that have these upper level studies that are critically appraised, that are the clinical trials, the placebo controlled, the whole ball of wax. And for the size of our company to have published 7 of these type of studies is unheard of. But we have those, and we will discuss those in detail in the next presentation. So what I'm going to show you here are the references, and in this presentation, which you have a link for, this is an active link that takes you into each one of these studies. So if you have a question about how a product or an ingredient works or what it's supposed to do, this is all the scientific documentation here. This is all on the spores helping to recondition. This is all on the prebiotic, on how it helps the keystone strains and how the individual oligosaccharides, all the documentation on how they help the keystone strains. And this is how the mucosal barrier is, how important it is, and all of the documentation for that whole step of the program. So that covers the introduction. And let's see, we have one more slide. No, okay, so that's, now I'm going to go into the deeper presentation. And here we are, lecture 1. Okay, so there's some foundational lectures that I've given that we don't have time to do here, but know that they are all recorded, and there are links to each of them as well. So I'm going to quickly cover them here. For instance, so we covered the objectives of the introduction, who, what, why, microbiome labs. My personal story is on the YouTube presentation about all the exposure to glyphosate and cancer story, and we covered the protocols. And then we went over the cohort studies or associated studies. Now what we want to do is go through the specific published studies that Microbiome Labs has done, give you a background as to why probiotics do not seed mature microbiomes, and a background explanation of non-spore probiotic limitations, and then go over some case studies that will hopefully help you pull it all together, help you connect the dots, and give you some real pearls, aha moments, and so forth. Okay, so let's actually put this on presentation mode. There we go. Okay. Again, this is a presentation on the YouTube video as well. And if you haven't ordered on your account, or you don't have an account, then that presentation will show you how to set one up and how to order. And it will go through Patient Direct and how you get referrals and everything. So know that that's on the YouTube video. There's also a YouTube video that talks about developmental microbiome, how the inoculation for your microbiome takes place, what affects it, and then after 2.5 years, then you have a mature microbiome. You don't add to it. You can influence keystone strains that are there, but without a microbiome transplant, what you have after this point is what you've done. Conditioning effects, of course, if you had a C-section or bottle fed or antibiotics or certain health conditions, bad hospital environment, vaccinations, pharmaceuticals, glyphosate, you're going to have a damaged microbiome. We go over this dispersion on how the individual microbiomes branch off of the initial inoculation and become their own unique, but connected to the gut. So all of that, again, is covered. We have a YouTube talking about how probiotics influence the microbiome and the influence of non-spore probiotics and how they're tested and how we know they're digested in the gastric barriers and that they have very limited and very little influence. And if you don't do Shime testing on probiotics, you don't have tests on probiotics. Okay, so we just covered this in the previous lecture. This is a great chart here, and I would also laminate this because so many of the die-off reactions, symptoms, toxicities are caused because of lipopolysaccharide. And it is, again, the most powerful endotoxin. And look at the behavioral type of modifications it influences: mood and appetite, depression, on two different levels here. It's going to increase inflammation that inhibits dopamine, as well as increase the turnover of serotonin. It's involved with anxiety, chronic pain. So, you know, this is important when you're sitting down with someone and they don't understand the gut emotion connection or the gut brain connection or the gut skin connection. This is a good slide to sit down and talk to them about. This is the foundational study we mentioned that focuses on metabolic endotoxemia, but it covers more than just the lipopolysaccharide. So if you look at what analytes were tested, you know, this is the groundbreaking discovery, really, is that it reduces lipopolysaccharide by 60% in 30 days without any dietary changes. But all of these other analytes were also tested, and all of these came into significance in 30 days. This study was just published, and we'll go over that, on the triglycerides. So this is what you should expect. If you are truly healing the gut, then you should start seeing these analytes, these chronic illnesses, these conditions get better, right? So, and significantly, as in, you know, triglycerides get better as if you were using a drug. So we're in process of a weight loss study, hence the ghrelin and leptin. We've got these different inflammatory markers, some of them very specific for either Hashimoto's or rheumatoid arthritis. Both of those studies are in process. And this whole study was repeated for a 90-day outcome. And it shows that these markers come into significance. And that's important, again, because of diabetes, because of other inflammatory conditions. So know that, and I've got a slide on those studies, and we'll talk about them. This is a Shime study. So Shime, this is a technology that was developed at Ghent University in Belgium. There are some other universities that use it. There's one in Canada that uses it. It is the be-all, end-all way to test probiotics and the microbiome. It stands for Simulator of Human Intestinal Microbial Ecosystem. So they basically simulate a GI tract. They inoculate it with a microbiome. They feed it things. This is how you study the impact on a microbiome. You feed it probiotics. This is how you find out that they get 99% digested in the stomach. And how you currently, we've got a glyphosate study that is in process. So this system was inoculated with a pristine microbiome. Then it was fed Roundup. Then all of the disease markers were measured. So we know that after 4 weeks, a gut will show all the markers of gastrointestinal disease. But the upside, the good news is, then you feed it the spores, and after 3 weeks, you shut down that disease process. And that's real exciting. And after that point, things start getting better. So that's going to be a landmark study. There's not been any studies in the US that show this with Roundup and glyphosate, and if they would probably get knocked off, but that's why this is going to be real exciting to get that in print. This is one of Microbiome Lab's publications. This is the one showing that Megaspore jumpstarts the whole system, gets the short chain fatty acids, all of the metabolites, the reconditioning going, and will increase those keystone strains by about 20%. But it is the prebiotic that helps the keystone strains thrive and increases them by 80%. So that is real important. And that's what this study shows. Megamucosa, we don't have a study yet, but I did give you the links here for some real important associations of the gut-brain, gut behavior links that have to do with keeping that mucin layer intact. So, and also how the ingredients specifically, what studies they have on those specific ingredients, and how the IgG 2000 increases those CD4 cells. Again, real important for recognition. Okay, so again, that protocol is on the link. This is the foundation. We have, to customize for each person. And there are some case studies we're going to go over on how you customize. This is one of our publications on the one spore probiotic that we have. And just one of the spores, you can see, has a dramatic decrease in these inflammatory markers. IL-6 reduced by 45%, TNF-alpha by 55%. And there's another study that's in process right now in this product for the reduction of ammonia. And we already, it's being used at Mercy Hospital and Cleveland Clinic in their hepatic encephalopathy wards, because they recognized how important it was for hepatic encephalopathy or liver failure. So it's already being used, but we're just getting the scientific background documentation to show why. Here's another SHINE study publication that shows the effect of Megaspore on IBS. And the bottom line is it scored better than rifaximin. So there you have it. This is the study on the triglycerides. Again, very powerful. And the conclusion is that mild to moderate elevation of triglyceride levels can be lowered in patients with, hypertension by just a probiotic supplement. This is amazing. And, pharmaceutical companies are not going to want to hear this. But this is what you should expect if you're truly healing the gut. This is a publication from Microbiome Labs that shows the healing effect after damage done by acetaminophen. So here's the bottom line. Bacillus spores had a protective effect on acute hepatic injury induced by acetaminophen. Pre-treatment with Megaspore resulted in a significant reduction in the liver enzymes and inflammatory markers, also hepatic site necrosis, similar to the well-known hepatic protective agent, silymarin or milk thistle. So what you're hearing, I hope, is that you start with Megaspore. It produces so many vitamins, has so many protective effects, and then you look to see what's left over. This is how you cut down on all those bottles your patients complain about. Okay, so let's do some case studies here. First, we're going to talk about those individuals that are hypersensitive. These are your individuals that every time they do a food sensitivity test, they eat less and less. So their spectrum of food is getting smaller and smaller. I've actually consulted with someone who could only eat 3 foods. How do you survive like that? How horrible. What a boring life. But that's not, the sign of a healthy gut. A healthy gut means you're going to start expanding the diversity of your food, because that expands the diversity of your organisms. That's the sign of health, not the cost of increasingly, diminishing the amount of food that you could have. And you'll find that these individuals not only have food sensitivities, they'll generally also have the chemical sensitivities, and then they start developing the autoimmune disease. And when you have one, then you start, go from one to another. So this is going down a very dark road. So you start these individuals on the total gut restoration, and generally what you'll find, if you didn't know this person was hypersensitive, is that they're struggling to get on the full dose of Megaspore. And then you tell them, well, open up the capsule, do a fourth to a half a capsule every other day. And some of those hypersensitive folks are fine with that, and then they can sail on through their total gut restoration. But you're going to have a percentage that are hypersensitive. They cannot even do a pinch of Megaspore. So those are the folks that you say, hang on to your bottle and start with the 1 spore probiotic, and then graduate to the 2, or eventually graduate to the 5. Help add the IgG 2000, because that's going to help you tolerate the spores better. It's going to neutralize the lipopolysaccharide, the viruses and parasites and everything else that might be going on in there, to help your immune system work better. And in some cases, you might just start with the IgG 2000 to pre-treat them. They are so toxic that they just look at the labels, or they just think about taking a supplement, and they start breaking out in hives. So that's kind of how you handhold, with white gloves, some of your canaries. So what's happening with these folks is that they have such a damaged immune system that they must retrain their immune system with these bacillus spores. And what they do is upregulate the Treg cells for recognition from self from non-self. Studies have shown that infants that are not exposed to spores will develop immune deficiencies. So these spores have been in our environment since the dawn of man. We are meant to have exposure to them. The problem is that this chain has been broken because of any number of reasons. The way we do agriculture, the way we do our food supply, the way we birth babies, you name it. It's a recipe for just failure of our microbiome. Okay, another case study. Let's talk about when you've got upper digestive involvement. So what we have found out about bile is extremely important. There's a whole book written about it, phase 2.5. I think Dr. Halterman is the one who wrote that. And it's so important that it has its own detoxification phase. Bile is antimicrobial, and it helps keep the dysbiosis down in the upper digestive tract. So if you have sluggish bile, you're going to have increased dysbiosis in the upper digestive tract and open yourself up for SIBO, or small bowel overgrowth. And the dysbiotic organisms are going to unconjugate the bile, releasing toxins which further irritate a damaged gut. And that's going to cause diarrhea because your body's trying to flush it away. Or the lipopolysaccharide is going to be released and just completely shut down the bowel ability for motility. And then that's going to lead to constipation, gas, and bloating. And all of this is triggered from the bile, the upper digestive tract. So this is important to recognize. If you've got an individual with GERD, reflux, H. pylori, and if they're having already some of these symptoms, you want to help that. There's a great product we have called MegaGuard. Yeah, and we have a whole, again, in those YouTube videos, we have a whole lecture just on the ingredients and how that works. But that you want to start right off with the MegaGuard, then go into the total gut restoration. You might have to back off again on the Megaspore, add the HU58 in addition to the Megaspore because you've got an overgrowth situation at that point, and then have that IgG 2000 on hand as well if you've got a real toxic individual. So to recap the situation, without release of antimicrobial bile, dysbiosis increases, pH barriers, which act as the bacterial zip codes, are lost, and the lower GI tract organisms swim upstream. So that's really, at the heart of what's going on. And people will ask me, we've been tested for SIBO, and I don't know if we can do the total gut restoration because there's a prebiotic in there, and we've been told we can't use probiotics and prebiotics. We've had hundreds of people with SIBO do this program, start slow, they do great. So don't worry about all that. It's not panning out to what's really helping these individuals. Okay, a case 3. What if you have a known parasite, or you have C. diff, or you have a virus? This gets back to the very first slide in the first lecture. Do we go in and A-bomb it and eradicate it and clean the person out and sterilize their gut? No, don't do it. Stop. Because what you're doing then is you're damaging the commensal communities, you're damaging the mucin 2, you're damaging the good biofilms, you're making a bad situation worse, okay? So the new paradigm is you make the terrain, you make the environment inhospitable for pathogens to flourish. You competitively exclude them, and you force them out, you breed them out, you eat up all of their food, and they don't want to be there. So that's the better, gentler way, okay? And you do that with, again, competitive exclusion. You're adding more spores to your protocol. So when you've got a serious overgrowth, you add 2 Restore Flora at breakfast, 2 Megaspore at lunch, 2 HU58 at dinner, and the order of these is not important. You can change all that around. It doesn't matter. The idea is get all 3 of them throughout the day and force those pathogens out. And then use the total gut restoration to clean up the damage. Okay, so the 5th case is just really kind of a reinforcement why you want to get through the whole program. Because we know Megaspore is going to decrease the lipopolysaccharide by 60%, increase the short chain fatty acids by 45%, increase the keystones by 20%. We know that the prebiotic is going to increase those keystone strains by 80%. It doesn't contain milk or corn or reactive agents because it's 100% oligosaccharides and it's non-vegan. We know that the Megaspore, or the Megamucosa, even though we don't have now the clinical study yet, we've got so many anecdotal case studies, and I mentioned a few here. One real serious case of a 5-year-old who had a resected bowel, who was faced with having to be homeschooled for the rest of his life because he was messing his pants 6 to 7 times a day, and this completely consumed the whole family. So long story short, they did the Megaspore, they did the prebiotic, they got 75-80% there. But it was the Megamucosa that is the reason he's in school. And he goes once a day like everybody else. So anyway, and we've had hundreds of people with lifetime bowel issues that claim this was the pivotal product. And I think one test of the pudding is you take a product away and then reintroduce it. If you're then getting pushback from your microbiome organism, then that's a telltale sign of the impact that product was having. And we hear that many times too. Okay, so as I promised you, we were going to, again, we talked about these critically appraised clinical trials, which are, the filtered information, not like the cohort studies. So that's what we discussed in this lecture. And this is kind of contraband. I took a picture of our update, which we're not supposed to share with anybody, but I think this is important for you to see. These are the studies that are right now completed, will soon be in print. the microbial diversity. This is using megaspore alone, just so we can really firm up those statistics so we know exactly how much diversity just the bacillus spores have versus the prebiotic here. So, and then antibiotic-induced dysbiosis with the HU58, antibiotic-induced dysbiosis, the super duo. This is that glyphosate study that I told you about. There's a dermatology study very close to publication now. This was done, I think, with the University of Sacramento. The bottom line here is that it reduces acne blemishes by 50%. That's huge. And we're talking about just a probiotic doing this. Hepatoprotection, the triglyceride, we saw those. Hepatic encephalopathy. Now this is the one that's showing that reduction of ammonia, and that's huge because, yeah, liver failures is pretty awful. 90-day metabolic endotoxemia. That's, again, we repeated that landmark study at University of North Texas. So this is the extension of that from 30-day to 90-day. We got that weight loss study I mentioned, a periodontal disease study, vaginal microbiome study, a C. diff study, rheumatoid arthritis, cancer immunotherapy, immune modulation, a secretory IgA, chronic inflammation, leaky gut study in dog. And as many of you might know, we launched a phytospore, which is basically a megaspore for dogs with some liver flavor, so they'll eat it. This study is going to be in print real soon. Bottom line is dogs have metabolic endotoxemia just like humans, and megaspore or phytospore reduced lipopolysaccharide by 45%. Again, big game changer for dog health. So this one in discussion is post-surgical ICU patient recovery, antibiotic-associated diarrhea in kids, and then these are published, the 30-day one, the cardiac with MildMax, HU58. So that's just a little look what's in the pipeline. Those will be announced when they're done. And yeah, so these are some of the centers. For instance, if you see, on our label, you'll see a lot of our strains start with HU, like HU58, HU56. That HU comes from Holloman University. So this is a spore bank in London that can, genetically types all of the organisms, keeps them pure. It's kind of the elite place, to get your spores. So that's explains that. This Progest, this is the Belgium company that does the Shime tests. Like I said, Mercy Hospital, Cleveland Clinic use our products. They were the ones that really pushed for the ammonia study on the HU58. It's UC Davis, I think, is the dermatology studies. I'm not sure what we're doing with them. But anyway, we've got a lot of partnerships out there. Cosmos ID now is for the next lecture. And yeah, so that really wraps up our lecture part of it. I'm going to hand my phone to Ken so he's going to pick out some of the most common questions and answer those. And we're going to take about 10 minutes to do that, and then we'll start switching over and getting ready for the next lecture. So I'm going to turn the floor over to Ken. Did you know I was doing that?
So, I haven't got any questions.
Oh, you haven't got any questions? Well, I have got some on my phone, so let me look here. And okay, so the question is, how long would you pre-treat with IgG 2000 in a sensitive person?
2 weeks.
Yeah, I would say from 1 to 2 weeks, again, depending on how sensitive that person is. And I would titrate up. I would start, with 1 capsule the first day, 2 capsules the second, 3 capsules the third, 4 capsules the fourth. And if they can't tolerate that, go slower. Know that IgG 2000 is the same product ingredient as enterogram. Enterogram is a pharmaceutical drug. The dose is basically 8 capsules. So if you use the nutraceutical dose, it's 4 capsules. You can go up to 8 capsules. That would be a pharmaceutical dose, but some people may need that because they are so toxic, whether it's exotoxins from candida or endotoxins from bacteria. Okay. All right. So she has another, or this person has another question on mentioning Hashimoto's disease. What study are you doing? I did not see that on the latest update. So I'm not sure, that might already be in process. And sometimes they don't want us talking about certain studies when they're just about to hit the print, because the publishers have put like a gag restriction on them, because their feeling is if people are talking about it, why do they need to print it or something like that. Anyway, but yeah, I will get back with you on that because I'm going to have to find out where that study went.
Another question.
Okay.
What are the symptoms that indicate need to back off Megaspore and go to HU58 or IgG2000?
Okay, so I'm going to repeat that question. What are the symptoms that indicate the need to back off of Megaspore and go to HU58 or IgG2000? It's very specific to the person. It can be anything. I would say the most common, gas and bloating. That's usually the first, signs. I have heard some people emotionally crash. I have heard some people break out on their skin. But again, I would say the most common is the gas and bloating. Okay, got some more questions here.
What about the parasite giardia?
My daughter. Okay.
Yes, you can.
The question is, how is Microbiome Labs IgG2000 different from Zymogen's IgG200? Okay, good question. There's some history on that. Many of you may not know, I used to work for Zymogen. I launched when Zymogen had the original IgG2000 serum-based. It was their flagship product. That product put Zymogen on the map, and they started putting it in everything. There was some controversy. Some said they lost their contract with them. Others said when the company went to make Enterogram a pharmaceutical drug, they stopped selling to nutraceutical. Regardless, Zymogen stopped selling it, and they still don't have it. They have, I think, an egg-based or a colostrum-based. I can tell you it's far inferior to the IgG2000. IgG2000 has 50% more immunoglobulins. It's much purer and stronger, and has no egg or milk antigenic reactions. So that's how it's different. Great questions. Do know you can keep these questions coming throughout the break. I'm going to go and just take a picture again of participants so that everybody is sure to, I have some documentation, and if they need to know who was participating, then I can prove it. So I'm just keeping track of that. Okay.
I have a post-bowel resection and chemo colon cancer patient. I love to hear the order protocol for such a patient. Tests.
Okay. So, and what I was saying is all these questions, we will answer them even if we don't get to them on kind of the live presentation here. So I'm going to end the recording. All right.